Hi, my name is Janousek, and I'm going to be taking a few minutes today to talk to you about antibiotics and some of its uses and misuses. Antibiotics such as penicillin have been around since its development before World War II, and it was essential to the war efforts of the Allies in its fight against tyrants such as Hitler. It was such a miracle drug when it was first developed that it saved the lives of thousands of troops and civilians during the war and for many years after. Penicillin was created by a fungus that actually created it as a means of its own warfare against other microbes, and it was discovered merely through an accident. A scientist was inoculating other dishes with bacteria, and it just happened to catch some spores which grew into colonies, and noticed that those colonies were preventing other bacteria from growing. As an aspiring laboratory scientist and a patient who has suffered from rheumatic fever, an illness requiring heavy doses of antibiotics to treat, I will talk to you about how the overuse or misuse of a miracle drug can create a looming nightmare for our society. Because of the increase in antibiotic-resistant bacteria, more people than ever are contracting diseases that are difficult to treat and can oftentimes be fatal. According to the Antibacterial Drug Resistance, a project done by Dr. Nordberg, there is a correlation between antibiotic use and the number of cases of penicillin-resistant microbes being found in hospital environments. As you can see, as more doses of penicillin are being consumed by people, the percentage of penicillin-resistant bacteria infections is increasing. Down at the bottom of the scale, you see European countries here that have a very low use and a very low infection rate. As we go up the scale, we find the United States, which is kind of in the middle, give or take 30% of the population, or 30 DDD per thousand population. Doses are consumed by us, and roughly 40% of our infections are seeing a resistance to penicillin. Costs of healthcare are an ever-increasing expense for the average American family. When we look at costs to the family as well as cases that are paid for by the state agencies, we are seeing a rise in costs to patients to treat these antibiotic-resistant infections. According to the Alliance for the Prudent Use of Antibiotics, the societal financial impact of $15 million based on just over 188 cases of ARI, or antibiotic-resistant infections, is an alarming finding, said Dr. Robert A. Weinstein, Interim Chairman, Department of Medicine, Cook County Hospital, Professor of Medicine at Rush University Medical College, and a senior author and initiator of the project at Cook County Hospital. Because 20 to 30% of the hospital's pharmaceutical costs are due to antibiotics, the emergence of antibiotic-resistant opportunistic pathogens, or MRSAs, the total cost to the healthcare system was estimated between $75 million to $35 billion annually. The ubiquitous nature of antibiotics in our food system, such as in livestock feed or water system or our personal use, has exposed numerous strains of bacteria to wide-spectrum antibiotics. Just like our own immune systems, these bacteria will eventually build an immunity to the antibiotic, and through a process called horizontal gene transfer, they can pass on those traits to other microbes or to its offspring when it divides. Many of these germs are only resistant to one or two types of antibiotics, but once a strain has developed an immunity to a broad range of antibiotics, it becomes almost impossible to treat and is termed a superbug. A recent outbreak of carbapenem-resistant Klebsiella pneumonia in 37 of the 50 states has a 50% mortality rate and is considered a community-acquired pneumonia. In 2012, it claimed the lives of 7 out of 19 patients infected by it. Most of these patients were patients who were in intensive care and had a compromised immune system, and typically when a patient who has a compromised immune catches an untreatable infection like this, it will lead to a fatality. When I was 10 years old, I caught a disease called rheumatic fever, and it was caused by catching group A streptococcus, or strep throat. The only treatment that they have had for that disease over the years is basically a heavy regime of penicillin, and I was required to take heavy doses 3 times a day for 10 years. This would have led to my immune system completely shutting down. The antibacterial properties of the penicillin would have taken over most of the efforts of my immune system and would have weakened it. And then if I would have caught a penicillin immune disease, I wouldn't have had any way that I could have treated it. And it may have caused me to catch rheumatic fever again, which has a 20% chance of actually killing me. Luckily for myself, or unlucky depending on how you look at it, I was very stubborn, and after 3 years actually refused to continue taking the antibiotics. And I feel as a result that my own natural immune system has benefited from it. I have managed to stay away from strep throat, and I think that this natural approach, while using it under dire circumstances, just being cautious, has actually led to a healthier life. And who knows what kind of penicillin immune bacteria I may have caught if I had continued taking that penicillin. So all of the issues, either personal or societal, can be overcome by a little personal responsibility on our parts. By educating ourselves about how an antibiotic works and when we should use it, we can reduce the amount of antibiotics being introduced into our environment, and as a result, decrease the frequency of microbes becoming immune to these antibiotics. Antibiotics have absolutely no effect on viruses such as the flu and common cold, but a lot of people will still try to take antibiotics to get rid of these viruses. In our society, our food is mostly driven by supply and demand. The FDA requires that all organic meat is hormone and antibiotic free, if it's labeled organic. Currently, the American consumer demands cheap food in bulk, and in order to do that, the farms have to send all of their animals to crowded feedlots and apply wide-spectrum antibiotics to their animals in order to prevent herd diseases. If the demand for organic foods increases, we wouldn't have a market for these animals that are injected with hormones and fed antibiotics. When these other two issues are brought under control, the issue of our increasing health care will have an opportunity to fix itself. According to a clinical study performed by the Center for Disease Control to show a correlation between penicillin consumption by patients in ICU, countries who had a higher consumption rate had an equally high rate of infection by antibiotic-resistant bacteria. Coming back to this study, the use of antibiotics would be used only in emergency situations, and hopefully as a result the frequency of antibiotic immune bacteria would decrease. Our government would be spending $75 million instead of $35 billion a year to fight those infections. So imagine yourself at a grocery store. You have a mild infection and you're looking for a way to heal yourself. You have a prescription for some antibiotics that your doctor gave you. In the section for natural foods, you see an alternative remedy, such as colloidal silver or grapeseed extract. It occurs to you that the alternative treatments are far cheaper than the visit to the doctor and has no side effects. I personally have used them over the years and have found that they are as effective and absolutely have no side effects. At the same grocery store, you're shopping for groceries and you have the choice between some cheap, low-quality meat or an organic alternative that only costs a little more thanks to some efficient organic farming methods. The organic food is healthier and has stricter regulations regarding what a farmer can put in it. You know by buying the organic food that you're reducing antibiotic abuse and supporting humane farming practices. Because our society is growing and we are living longer, the need to create a safe hospital environment and safe food supply is more important than ever. Although antibiotics were great in their time, they have been overused and it is creating a society-wide health risk. We are now seeing a trend in the medical field where antibiotics are only being prescribed in more severe circumstances, but we still have a long road ahead of us. Go educate yourself about what's in your food, educate yourself about how antibiotics are used, and how they are needed so that we can all live a long, superbug-free future. Thank you.